Thank you so much for joining us. I'm Alex Bell, and this is To the Point. We are bringing you more context and more information on issues impacting us right here in Northern California. So let's get right to tonight's main point. Should people have the same access to mental health care as they do to physical health care? Increasingly, experts, lawmakers, and certainly patients are all saying yes. But getting there requires changes, and that's why Kaiser Permanente mental health care providers are on strike across Northern California, and it's now stretching into its 9th week. And last night, Becca Habegger explained what's at the heart of the strike, but tonight she shows us why this problem, it goes back more than a decade.
So at the beginning of 2021, I think like a lot of people going through the pandemic, I realized that I needed to seek mental health care.
Maya Poland lives in Sacramento and describes seeking mental health care through Kaiser Permanente as convoluted and stressful. As part of the process, she says, Kaiser referred her to an outside provider.
Because the wait within Kaiser would be at least 8 weeks to do intake with a new therapist, and then another 8 weeks to schedule that first appointment, which just wasn't something that could work for me.
So she says Kaiser gave her a list of 10 external therapists.
I called through every single therapist and none of them were seeing new patients. Half of them had retired, despite Kaiser saying that these were people who were seeing new patients. From there, I got another list of 10 people. The last person on the list was able to see me, but not through the referral type I had. So I spent 6 months trying to get Kaiser to give me the correct referral type.
They eventually got it worked out and Kaiser reimbursed the provider, but Poland says it was a long and stressful process.
It is not our expectation that a consumer who's having a mental health crisis is going to call 50 providers, whether that's in or out of Kaiser, to find an appointment. That's the health plan's responsibility.
That's Mary Watanabe, director of the California Department of Managed Health Care, or DMHC, speaking at an August hearing of the State Senate Select Committee on Mental Health and Addiction. Watanabe's department oversees health plans, including Kaiser Permanente. This hearing was just days before mental health care providers at Kaiser were set to strike across Northern California, so committee members were asking about Kaiser's ability to provide timely access to mental health care.
We have enough information to indicate that there is a problem with access to care of behavioral health services at Kaiser. From 2020 to 21, we also saw a 20% increase in complaints to our help center from Kaiser enrollees.
She says her department has launched a special audit of Kaiser specific to timely access to mental health care. But this is an ongoing problem the DMHC has been following for years. In this routine audit of Kaiser conducted a decade ago, the DMHC found Kaiser was not ensuring timely mental health care appointments or tracking which contracted providers were available. It wasn't fixing issues quickly enough and not offering patients enough information on how to best access mental health care. The findings resulted in a $4 million fine, which Kaiser ultimately paid, but subsequent reports found many of the problems went not corrected, documenting ongoing issues with timely access to mental health care. So what is Kaiser Permanente doing? As part of bargaining with the providers, Kaiser says it's meeting the union halfway on demands for more indirect patient care time. Plus, we have shared with our therapists that we will have a framework to provide practice support that will dramatically free up therapists' time by having administrative and clinical professionals, including psychiatric techs, take care of administrative-related tasks and other work that does not require a licensed therapist. This means freeing up more of their indirect time. We estimate this could be as much as 30 to 45 minutes per day. Providers do want more of this time, but say what Kaiser is offering at the bargaining table is not enough. Meanwhile, Poland points out she gets great physical health care through Kaiser.
When I want to see a doctor, a dermatologist, my primary care, whatever that may be, I can see them within a week, which is really, really amazing. But to have to go through this entire really stressful process, really anxiety-inducing process, and then have to wait that long to be seen by a provider is just absolutely like shocking and horrifying.
And Becca's with us now. You've been covering this for a while, and there is a law now that requires Kaiser to provide timely mental health care services. Can you talk about that?
Yeah, we've been talking about it over the course of the coverage of this strike. It's called SB 221. It essentially requires health insurers, health plans, HMOs like Kaiser Permanente to offer follow-up appointments for mental health care within 10 business days. If a therapist, however, says a patient can wait longer, they can, but that's for patients who need it. And healthcare providers, mental health care providers who I've spoken with tell me that a lot of patients do need that immediate health care follow-up. And as you can see from this patient and from other patients we're hearing from and other healthcare providers, often there's a wait of 4 to 6, even 8 weeks before someone can get that follow-up appointment. So SB 221 requires places like Kaiser to provide that follow-up.
And some people at home might be wondering, how does the state make sure that Kaiser is actually following this?
That's a great question. So the California Department of Managed Health Care, they have several ways to ensure that. One of them is a help center hotline where they're collecting consumer complaints. Let's say a patient says, hey, I'm told it's going to take 4 weeks for me to get a follow-up mental health care appointment. They can call that number. The Department of Managed Healthcare says they are tracking these, and those indicate when a health system might have a problem. There's also audits that the Department of Managed Healthcare can conduct, like the one that you saw in this story. They also require these insurers to submit annual reports. So there's several ways that they're tracking it. And again, this is the first year SB 221 is in effect, so we will see how effective it is. Yeah, for sure.
All right, Becca, thank you. We appreciate it. All right, after the break, we are hearing from a Sacramento mother's personal experience with mental health issues and the troubles that she's faced to get care. So yesterday on To The Point, we asked you to share your mental health care story. We asked if any of you have had trouble accessing mental health care. And we did hear from a woman named Krishan. She lives in Sacramento, and recently she lost her newborn. But she was gracious enough to share her story with us tonight.
In May this year, I was pregnant. I actually had a placenta abruption and had to deliver my baby 13 weeks early. That was hard enough. Especially, I had just been in labor and delivery 2 days before. My baby was in the NICU. I had to go there back and forth to visit. And at 13 days old, he passed away. His name's Gino. And that was really hard because it was sudden and out of nowhere. By the time I got to the hospital in Roseville from South Sacramento, my baby passed away within 15, 20 minutes of us arriving. And so from there is when I decided I needed to talk to somebody because I can't just get through something so traumatic alone. And that's when I finally got a referral from my OB to get psychiatric help to talk to the therapist at Kaiser. The triage appointment, I was scheduled to meet with one provider. And I was given a call that afternoon and said, I'm just calling to let you know your appointment for tomorrow is canceled because of the strikes. And you'll receive a call in the morning about your appointment because we just don't know who'll be at work. I spoke to her and it was fine. We had a connection. My original due date was August 16th. And that day, I had received a phone call from pediatrics from Kaiser asking me to schedule a well visit and shots for my baby. And that just triggered me even more because I was on this road to recovery and like learning to live with my grief and what happened. And I just keep getting triggered. And I reached out to my psychiatrist and I explained to her what happened. And she called me and we had a conversation, which was great. However, in her follow-up communication, she ended up spelling my baby's name wrong. I just felt like that connection was gone. So I wanted a new psychiatrist or a new referral. In that process, I reached out to the OBGYN and my primary care, and I finally talked to psychiatry and got an appointment. They told me that the next available appointment was 4 to 6 weeks out. And I was just like, well, what am I supposed to do in the meantime? There's nothing in the meantime unless I chose to get an outside referral. I opted to stay within Kaiser because I just didn't want to jump through any more loopholes and back and forth with people. And so I stuck with that initial appointment. However, I currently was in conversation with the ombudsman for other reasons. And I was explaining to her about the psychiatry and how far out it was. And she actually helped me get an appointment within 2 days by reaching out to someone. And so I have an established provider, but if I didn't have her help, I would have been sitting at home for almost 6 weeks, just waiting for a phone call and just coping by myself. And so it's been a long road.
Before we move on here, I want to say that we've heard from so many of you at home, and we know that sharing your stories with us is not easy. So I want to say thank you to everyone who's reached out to us. And thank you, Krishan, for being brave enough to share your story with me this afternoon. I really do appreciate it. I also want to mention that Krishan tells me that she has a good connection with her new provider, and she has a session at least once every 2 weeks and feels that it has been a success so far. Her advice for others is to not give up on yourself and do not take no for an answer. If you need to talk to someone, keep calling in. There is a mental health care referral service that is available in Sacramento and Yolo counties. The 3 numbers that you can dial right now are 211. And this is a free, confidential information and referral service that is available 24 hours a day, 7 days a week. All right, you might have seen it. Across the street from the state capitol sits a monument honoring Latino soldiers. But why is it the only one on state property? A decision to slash the rooftop incentive program for solar panels is looming, and hundreds of people had something to say about it at the Capitol today. Their message, it's hard to miss. Governor, keep solar growing. So here's the deal. Utility companies buy back excess energy from solar users at about 20 to 30 cents per kilowatt. The California Public Utilities Commission wants to lower that to about 5 cents. So that means that the average bill for a solar customer could go from $82 to more than $200. So those in favor of lowering the incentives say that it will lower utility costs for disadvantaged communities. They say that the people with solar panels aren't paying their fair share. But those against slashing them believe that the lower incentives hurt those communities. Now, there is no date for when this could happen, but we are continuing to keep an eye on this. But speaking of all of that sunshine, let's go ahead and take a look at our Gilmore backyard here. Temperatures not looking too bad as we take a look outside. Sacramento seeing 85, most areas seeing around 80 right now. And here's a quick check of your 10-day forecast. All right, let's go ahead and get to our next story. Tonight, we look back as we near the end of Hispanic Heritage Month. Latino people have helped Americans fight in just about every war, dating back to the Revolutionary War. But there is only one Latino military monument on California state property. John Bartel takes us through the history of that monument and what one group is doing to enhance it.
Shaded by trees and often blocked by parked cars, a lone soldier stands at attention towards the American flag that flies over the California state capitol.
And as at one time period, it was called the homeless soldier because it had turned green because of the moss.
You wouldn't know it unless you walked up and read the writing on the concrete, but this is the California Mexican-American Veterans Memorial, also known as El Soldado.
I'm very emotional when I look at it because, again, my family has served.
Pedro Hernandez, Mina Perez, and Robert Ruiz are all among the many caretakers of the statue. Their nonprofit group El Soldado Latino aims to preserve and enhance the monument.
The Latinos have always contributed to this country.
It's estimated that 500,000 Latinos, mostly Mexican Americans, served in World War II. They were pilots, infantry, and seamen, and some of those Latino servicemen made the ultimate sacrifice.
When you put on the uniform as an American, you are American of Mexican descent.
This marble statue is one of the only Latino veteran memorials on California state grounds, and the only reason it's standing here is because of mothers who had no public place to honor their sons.
The mothers have been the driving force for moving the statue from where it was previously to its current location.
In 1948, a group of Mexican wives and mothers formed La Sociedad de Madres Mexicanas, or the Society of Mexican Mothers. Their goal was to create a memorial for Latino soldiers, and they did it through a series of grassroots fundraisers.
You know, they raised money by selling tamales and other food.
With thousands of dollars earned from bake sales and donations, the mothers commissioned sculptors to carve this marble statue, which originally was placed at the Sacramento Mexican American Center, where it stood for over 20 years.
And then in 1975, my aunt was part of the mothers to move the statue to its permanent location here.
In a way, El Soldado is a generational monument. Latino mothers of World War II built the statue to honor their fallen sons. Then, Latino mothers of the Vietnam War moved the monument to the state capitol to honor Latino veterans of all wars.
The daughters took over, and the daughters, to some extent, have passed away as well, just because of age. And so now it falls on this younger generation.
Today, Latinos make up more than 17% of enlisted military members. And to honor the future Latino veterans, the El Soldado Latino group wants to add benches, a commemorative wall, and a marble stone that names all the Latino Medal of Honor recipients.
We're in phase 2 and 3 to complete it, but it will cost us $1 million.
Fundraising and enhancement efforts have been slow. Thousands were spent after vandals damaged the statue in 2015, and then again when protesters spray-painted the base in 2020. But much like the mothers and the wives before them, the El Soldado Latino group will continue their grassroots efforts to enhance and to honor the fallen Latino soldiers.
We want to be respected, and the best respect that you can give is respecting yourselves.
In honor of Hispanic Heritage Month, and to all the Latinos who've served, I'm John Bartel.
Okay, so what if we told you that we could obliterate a massive asteroid coming towards Earth? Okay, completely kidding, but it does turn out that we do have the power to slightly alter an asteroid's trajectory in the name of planetary defense. So if you missed it, NASA hurled a refrigerator-sized spacecraft, yes, refrigerator-sized spacecraft, toward an asteroid 7 million miles away. The mission was called DART, or the Double Asteroid Redirection Test. That is a mouthful to say. So the goal was to change its course even just a little bit to see if we could hypothetically redirect an asteroid that was headed towards Earth. So it made its impact about 2 weeks ago, and it actually worked. While it isn't quite to the level of what they did in Armageddon, the experiment went much better than expected. In simple terms, the Dimorphos asteroid was orbiting a bigger rock. It took nearly 12 hours to circle the bigger rock, but the DART spacecraft hit Dimorphos and shaved off more than 30 minutes off its orbit time. And scientists, they were just hoping to cut it down by 10 minutes. But would this actually work if an asteroid was heading towards Earth? NASA Administrator, Bill Nilsson says that there is a warning to this because timing is key. He says that it could potentially work, but it would need to be done years in advance. All right, thank you so much for joining us on To The Point. If there is something that you care about or you just want more information on, make sure that you reach out to me and the team. We have Twitter, Instagram, Facebook, or you can always email us. Thank you so much for joining us. As always, we truly appreciate it. We'll see you tomorrow. Hey, it's Alex. Just wanted to say thank you so much for watching. I really love hearing from everyone, and I hope that you'll stay in touch. Reach out to me on Facebook at AlexBellTV, or you can email me at tothepoint@abc10.com, or you can even send me a text message at 916-321-3310.